my name is Connie. I just wanted to share my experience in treating a patient today. So I had a patient who's given birth in 2013, and at the time it was a very traumatic experience for her. She was all teary-eyed and very emotional about the pain that she's been having for the last 3 years with minimal relief. So she comes to me with what she called split pelvis. She said that her OB-GYN, when in the process of her delivering the baby was sunny side up, and then it was a traumatic birth, and it was a very shameful experience for her. She was given a prescription to go to a physical therapist, minimal treatment, did nothing for the pain. And more recently, she was able to go to a chiropractor who then looked me up for female women's health pelvic floor specialist. She ended up in my office just last week. I treated her for 2 sessions, today being the second session, and she noted that it was a 180-degree turnaround. Number one, I think she was really happy that somebody was able to listen and really understand where she was coming from. The time in your life when you are pregnant and about to deliver a baby is a very sensitive one. I've given birth twice, one 12 years ago and the other one 8 years ago. It's a very personal, very joyful moment that you should really embrace. But I do think because of my 12-year-old giving birth was such a traumatic one for me as well, I just remember that, I just remember thinking how it could be improved. So I wanted to just give you a little bit of input on selecting your OB-GYN. That's number one. You want an OB-GYN that's going to understand and be empathetic toward this whole process. So if you're one of those moms who want to give natural births, make sure you have that in your birthing plan. I delivered a baby and my son's head was really big, and so long story short, I tore really bad and there was a lot of issues postpartum. Now I'm all over it. I was able to rehab myself back into good health, but there are a lot of women who have a lot of traumatic injuries due to due to giving birth. And it can really do a number on your pelvic floor health. So I want to really urge you to seek help and to let you know that you're not alone. 1 in 5 women have some sort of a prolapse down there with issues that we don't want to talk about. But I want you to know that there is real good help and support out there and that you're not alone. So I hope that that helps in you selecting the proper help and guidance when you're selecting your OB-GYN, and I hope that you have the best outcome when you're delivering your baby. But also, if you want to share a little bit of your story about your birthing process, whether it was good or bad, and recommend any physicians, please write to us at info@alkalinewellness.com, and then we would be so more than happy to showcase these physicians so that we can have them on our favorite list.